It's our proud privilege to have Dr. Neelam Dhingra, Unit Head of the WHO Patient Safety Flagship, joining us from Geneva. Thank you, ma'am, for taking the time to join us despite your busy schedule today. We truly appreciate you for the leadership in patient safety. We have more than 1,785 registered participants and over 100 hospitals that have joined us from their auditorium, conference rooms, and boardrooms. Can I request the Fortis Hospital, Mohali, to welcome Dr. Neelam?
Welcome, Dr. Neelam. I'm Dr. Shweta Prabhakar, representing Fortis Hospital, Mohali. And thank you, Dr. Neelam, for joining us. And we truly appreciate your leadership. Just have a wave for Dr. Neelam. Thank you very much.
Thank you. Thank you, Shweta and the Fortis Mohali team. Really appreciate it. Ma'am, we are looking forward to listening to you, your keynote address, and over to you, Dr. Neelam Dhingra.
Namaskar, and a very, very happy World Patient Safety Day today. And greetings from the World Health Organization in Geneva. Today is World Patient Safety Day, and it's really a remarkable event for us. I'm truly honored to be invited to participate in this very important event. And I, first of all, congratulate the CAHO leadership, in particular, Dr. Vijay Agarwal, President of CAHO, and Dr. Lallu Joseph, Secretary General, CAHO, for organizing this spectacular event, bringing doctors and nurses and pharmacists and health and care workers from around the country to mark World Patient Safety Day today. As you are aware, this year World Patient Safety Day is dedicated to the theme of medication safety and calls for action to achieve medication without harm. I must say that the collaborative efforts and the creativity and the innovation under CAHO leadership has really impressed me. In particular, the new initiative, Kaun Banega Gyanpati, as a national quiz competition on patient safety and medication safety has been really wonderful. So before I share some slides to scope the issue, I just want to say, join us in achieving medication without harm so that we can accelerate the actions necessary to ensure medication safety practices. And we truly believe that World Patient Safety Day this year will create a social movement for medication safety, which involves all stakeholders, from the grassroots to the policymakers and governments. So with that, I would like to just show a couple of slides and to scope the issue and also share with you what has been the WHO response in this direction. So this is the flag of World Patient Safety Day flying high today. So let's look into why medication safety. And I think before that, I would like to just share with you a scenario that whenever we go to a healthcare service, we presume that everything is going to be good and we are going to be taken care of. We never expect to be harmed when we access a healthcare service. We truly believe that this is going to help us. But there's a huge, huge burden of patient harm, as you know, which is avoidable due to unsafe medical care. And medication, particularly medication issues, are very, very prominent in this avoidable patient harm, because almost 50% of this harm actually comes from a medication-related harm. We understand that unsafe medication practices and medication errors are a leading cause of avoidable harm in systems across the world. And when we look at this huge burden of more than 50% of preventable harm in medical care coming from these prescribing and administration and monitoring errors, we really look at ourselves, and these are all avoidable. This harm is totally avoidable, and we have huge patient suffering and family suffering because of something which could truly be avoided. About 1 in 20 patients suffer avoidable medication harm, and 1/4 of this harm is actually severe and potentially life-threatening. Medications which are implicated are those which affect mostly CNS and cardiovascular systems, and elderly are more effective due to multiple morbidity and resulting polypharmacy. And we've seen that there is increasing prevalence from various studies of avoidable medication harm, which occurs in elderly patient care units, intensive care units, a highly specialized surgical care, and also emergency department. Some of the studies, particularly this report, which came a couple of years back on advancing the responsible use of medicines, showed that a total of 0.7% of global total health expenditure, or up to $42 billion annually, and these are only direct costs, not indirect costs, worldwide can be avoided if medication errors are prevented. And globally, most of the errors occur actually at the prescribing stage, about almost 64%, and more than half of these are preventable. And also at the monitoring stage, when patients are just prescribed and then they are really left to themselves, and almost 54% of these errors occur in monitoring stages. And again, almost half of these are preventable. And patients also make errors, but there's less research on patient errors compared to errors which are, which are due to the interaction between healthcare workers. And I don't want to say really blame healthcare workers. I think it's hugely important to keep that in mind, that it is the responsibility of the healthcare system to provide an enabling environment and also to provide a blame-free culture, as Dr. Agarwal mentioned about the culture, importance of safety culture, so that health and care workers can openly discuss the risk issues and can learn from errors and also prevent harm. But on the other hand, the interaction between healthcare workers and patients is the one where errors occur, and everybody has an important role in that interaction to prevent the risk of harm. The frequency of patients making medication errors themselves is between 19% to 59%, and patients also suffer harm because of their own errors in 26% of cases. So with the scoping of the issue, I just want to share with you what has been WHO's response in this area. WHO has been at the forefront of patient safety, as well mentioned by Dr. Agarwal explicitly. And particularly in the last couple of years, there have been concerted efforts to ensure that there are systems in countries which address issues related to medication safety. In 2017, WHO launched a global patient safety challenge, Medication Without Harm, with the objective to reduce severe avoidable harm over a period of 5 years, maybe up to 50%. So it was just a figure given to countries to aim up to something, which can be demonstrable that this can be prevented. And this challenge was launched at the Ministerial Summit in Germany in 2017. And since then, there have been several initiatives of WHO. WHO provided a strategic framework to shape this challenge, which identifies the main problem areas which need to be addressed as a systems approach. And these are like 4 domains, you can say: patients and the public, medicines as products, health and care workers, and systems and practices of medication. And there are deep, really, issues in all these domains. And this strategic framework, which I'm showing on the screen, also provides some subdomains under these domains, which actually identify the key areas or key interventions which have to be put in place to address medication-related harm. Priority areas where most of the harm occurs and where we really are asking countries to focus their attention are high-risk situations, polypharmacy, and transitions of care. Some of the resources the WHO has developed over a period of time are technical reports in these 3 areas, as well as patient engagement tool 5 moments for medication safety, which has a mnemonic STARS, which is starting, taking, adding, reviewing, and stopping. And these are like 5 moments when action by patients and families can significantly reduce the harm. So it's a very important tool of engagement with patients and families by healthcare workers. Similarly, we also developed important series of technical products, safer primary care, and medication error is one of the modules in this technical series. Over a period of time, WHO also developed resources on reporting a learning system for medication errors, the role of pharmacovigilance centers, and also patient safety incident reporting a learning systems, and how these 2 systems should come together to capture the errors as well as look into where the learning is. Last month, we also released a report on implications of COVID pandemic for patient safety, which looks into specifically issues of medication safety and the risks due to medication. So we believe that the theme of this year on medication safety had actually strengthened WHO efforts itself. While we were working on the challenge and the response, particularly with the theme this year for World Patient Safety Day, we initiated newer projects and programs. We are taking forward the No Check Ask campaign, which I will speak to you a little later. Patient family engagement, the 5 moments for medication safety, monthly webinars on medication safety, a study on burden of medication-related harm at the global level, looking at medication safety curriculum as part of a broader patient safety curriculum, and several medication safety solutions to address vulnerable population and clinical risk areas. And we also organized a global event on this Thursday to mark the day at the global level. And I truly believe that interaction between health workers and patients is something which we really can work on. And this year's campaign through No Check Ask can really help that interaction. Every time there's a clinical interaction between health workers and patients, there is a role for before you take it, no check, ask, and before you give it, no check, ask. And 5 moments of medication safety, again, is an important tool which can help this interaction. Some of the products which are upcoming in the coming weeks and months, as I mentioned to you, medication safety solutions. So medication safety, lookalike, sound-alike medicines is one of the medication safety solution we are working on. Medication safety in maternal and newborn care is another one. And a policy brief, again, to ask countries and policymakers to prioritize medication safety and medication without harm, and a global burden of preventable medication-related harm in healthcare, a systematic review. We truly believe that World Patient Safety Day this year, dedicated to medication safety, will help us and globally to consolidate the work of the ongoing global patient safety challenge and medication without harm. And our actions are now to be focused at national level, asking countries to prioritize action in these 3 key action areas. And while we are taking priority actions, we also develop programs which are sustainable, which are based on actual assessments at country level on medication safety, and we design targeted programs for change, particularly in the 4 domains of the strategic framework. And I believe that the Global Patient Safety Action Plan, which was adopted by the World Health Assembly last year, would provide an excellent framework for countries to take forward sustainable action in relation to medication without harm, which is one of the strategy embedded in strategic objectives on safety of clinical processes, and also at the policy level to look into major issues which cause harm. And I think having a framework for countries to report will provide a long way in demonstrating impact of the challenge of medication safety, as well as the impact of the World Patient Safety Day this year. So there's an indicator which we're asking countries to report on, which is significant reduction in medication-related harm. And every 2 years, we are going to monitor this indicator. So with that, I look forward to, with you, painting the world orange on this day, and join us in achieving medication without harm. And with that, I thank you immensely for your attention and for giving me this opportunity to join you today.
Thank you very much, Dr. Neelam. We strongly and truly believe that every problem has a solution, and we are committed to be part of the solution. Thanks once again for joining.